Good day. My name is Ethan Basch, and I am pleased to present to the forum on electronic patient-reported outcomes, or ePROs, as digital therapeutics that can improve patient clinical outcomes and decrease utilization of expensive healthcare services. These are my disclosures. I am a practicing medical oncologist at the University of North Carolina, where I serve as Chief of Oncology and as Physician-in-Chief of the North Carolina Cancer Hospital. I'm proud that we are a public institution that was built by and for the people of my state. I am also a health services researcher and have spent my academic career focused on developing technology solutions to capture data directly from patients to inform oncology drug development, quality improvement, and routine clinical care. Symptoms are extremely common among patients with cancer due to the disease itself and to the side effects of the drugs that we administer. Symptoms impair daily functioning and are a major cause of avoidable emergency visits and hospitalizations. Therefore, an essential component of cancer care is capturing symptom information from our patients and reacting to it to alleviate suffering and to avoid worsening or downstream complications. For example, in the care of my patient shown in this photograph who suffered from bone pain related to prostate cancer and to a multitude of symptoms from his treatments. Early in my career, I began to suspect that we as clinicians underdetect our patients' true symptom burdens and that clinical encounters like the one shown here, although very important for communication, might alone not be adequate for comprehensive communication about symptoms. So I conducted a series of studies comparing the symptoms that clinicians collect at such visits and which we believe our patients have versus the symptoms that patients directly report via systematic questionnaires. This slide shows findings of one such study where a cohort of patients and their clinicians reported the same symptoms at every visit over time. In the figure on the left, each box shows a different common symptom, with the orange line in each box representing the longitudinal cumulative incidence of that symptom reported by the patients over time, and the blue line representing the cumulative incidence of that symptom reported by the clinicians. You can see that across symptoms, the blue lines are substantially below the orange lines, demonstrating underreporting by clinicians compared to their patients. In other words, we miss much of what is happening with our patients. I believe that this isn't anybody's fault particularly, and I am as subject to this dynamic as my colleagues. There are complex communication challenges, psychodynamics, and time crunches in how patients and care teams interact that are at the root of this problem. Naturally, these results made me worry about the consequences of all of these missed symptoms, but I also felt that this represented an opportunity to do better, and technology solutions were ideally poised to bridge this communication gap and improve our detection of symptoms. The cartoon on this slide depicts just such a solution, namely implementation of electronic patient-reported outcomes for symptom monitoring. On the left, we see a patient experiencing symptoms. The patient receives an electronic prompt and self-reports symptoms into an ePRO system, which may be tethered to the electronic health record or be freestanding. If a severe or worsening symptom is reported, a real-time alert notification is triggered to the care team seen on the right, usually a nurse, for consideration of clinical action, shown along the bottom arrows. Closing the loop in this way with patients is essential, and we have heard from innumerable patients enrolled in ePRO programs how astounded and gratified they are when they report a bothersome symptom into an ePRO system, and 3 or 4 minutes later, the phone rings and it's their nurse calling to follow up on that report. That's the epitome of efficient, meaningful, and patient-centered care. There are multiple interfaces for electronic patient-reported outcomes to be administered to patients, and I want to make a side note that in our national US research, about 40% of patients prefer to receive an automated telephone call and use push buttons to answer symptom questions rather than web or smartphone interfaces. Those who prefer phone are more commonly located in rural areas with lower income levels and lower education levels. Therefore, we need to pay heed to how we collect information from patients in order not to allow the digital divide to translate into further healthcare disparities. The idea of symptom monitoring via electronic ePROs being a digital therapeutic to improve patient outcomes became interesting to me as a scientific question. So my research group developed the STAR trial, in which 766 patients with a variety of advanced and metastatic solid tumor malignancies were randomly assigned to one of two study arms. In an intervention arm, patients were provided access to an electronic ePRO platform through which they could self-report 12 common symptoms weekly. If patient-reported symptoms were severe or worsening, then a real-time message was conveyed to their clinical nurse for consideration of action. In the control arm, standard of care was given with no ePROs. We then measured the impact of the intervention compared to control on a host of outcomes. We found that compared to standard care, 31% more patients in the ePRO self-reporting arm had statistically significant benefits in quality of life, with 16% more patients experiencing improved quality of life and 15% fewer experiencing worsened quality of life. In an analysis of emergency room use, we found that compared to standard care, 7% fewer patients in the ePRO self-reporting arm visited the emergency room. Perhaps the most striking finding in this trial was a significant benefit in overall survival. Compared to standard care, median overall survival was 5.2 months longer among patients in the self-reporting arm. This translated into a 5-year absolute survival benefit of 8%, which was a greater benefit than all but one of the oncology drug products approved by the FDA during that same year. Additional findings in this trial were that patients in the self-reporting arm were able to stay on cancer treatments about 2 months longer than the control arm patients, presumably because their symptoms were better controlled, enabling better tolerability. Similarly, patients in the self-reporting arm had significantly better physical functioning, again likely because their symptoms were better addressed and controlled. A similar impact in overall survival was found in a subsequent French randomized controlled trial focused on lung cancer. And in a large observational study, including patients treated with all types of cancers across practices in the province of Ontario, Canada. Patient perceptions of these ePRO systems are highly favorable, with most patients stating that they find the platforms easy to use and understand, relevant and useful, and would recommend them to other patients. Similarly, most nurses and oncologists feel that these ePRO platforms are useful for documentation, communication, and to guide clinical care decisions. Despite evidence of benefits, uptake of ePROs in oncology practices has been slow. The main barrier here is financial. A clear business model does not yet exist, and payers do not cover the use of ePROs in practice despite the demonstrated benefits. At the practice level, implementation requires altering workflow and deploying adequate personnel to train patients, field alerts, monitor, and address compliance. Therefore, my specific recommendations toward the future are as follows. Number one, the Medicare program and private payers should provide reimbursement for symptom monitoring via ePROs in clinical oncology practice. For example, with a billing code that is substantial enough to support the technology and personnel deployment needs for this care enhancement. Number two, the use of ePROs for symptom monitoring should be adopted as a process measure for performance evaluation in oncology. And number three, implementation of ePROs in any given clinical practice should employ quality improvement best practices, as with any complex care enhancement, with particular attention to engagement of staff, leadership, and patients, and with ongoing monitoring of compliance. Thank you very much.